Hi, I'm Rachel Craig. I'm a mother-baby nurse, board-certified lactation consultant, and mom to almost two. I am about almost 10 months pregnant. I have a lot of moms ask me about bladder leakage, if it's normal, what causes it, if you can have it in pregnancy only, or if you have it after childbirth too, what's kind of the time frame of when to be concerned. So in this video, I wanted to address some of the reasons for bladder leakage in pregnancy and then after childbirth as well in the postpartum time frame. And then some of the ways that you can take back control of your body and feel comfortable. I'm here to tell you it is 100% normal. I just sneezed over there and peed myself a little bit. But I'm also reminding myself that I'm carrying probably an almost 9-pound baby, a placenta that is the same weight as that baby, amniotic fluid, extra blood volume, all that weight on my pelvis. So if you are, feeling that same way or you're wondering what's going on with your body, listen to this video. We're going to go over 5 reasons why bladder leakage happens. The first one is weakening of those muscles, like I said. If you look at yourself in the mirror, if you are pregnant, or you look at any pregnant person, you can see the amount of weight as they're walking around that kind of rests on that pelvic floor. And those muscles really include your uterus, your rectum, your bladder, all of everything that's sitting in your pelvis is affected because all of this weight and pressure is then on those muscles. That's totally normal. There's not really much you can do about that with the weakening of those pelvic floor muscles during pregnancy. But the good news is you can strengthen them after. You can do exercises through the MUTU program that will slowly help you strengthen those muscles and get that function back. So pregnancy and childbirth affect our pelvic floor muscles. There's not much that you can do about that fact. Like I said in the beginning, there's a lot of weight on those muscles. So not much we can do about it, but there is something we can do after, and that is our MUTU program. So it's a clinically approved program that takes you through a series of exercises slowly through your postpartum process, and you can build that strength back and build that function back. The second reason is hormonal changes. So when you're pregnant, your body produces this hormone called relaxin. And if you're pregnant like me, you're probably not relaxing. You don't feel like your hips and your pelvis is relaxing. All of those ligaments and muscles loosen, and this is a totally normal process. It helps our babies come out. It's a beautiful thing that our bodies do. So that hormone relaxin is totally normal, and after childbirth, you can do the MUTU strengthening exercises to bring that pelvic floor back into normal functioning, or functioning as it was before you had a baby. The third reason for bladder leakage is tears or damage to the pelvic floor. Not ever trying to scare anyone, but in childbirth, sometimes our vaginal muscles and tissues tear. Sometimes instruments are used and our pelvic floors can have a lot of trauma. So that will obviously affect our bladder and affect that entire region. The biggest tip in this time frame and healing from birth, especially if these tears or trauma have happened to your body, is to be kind to yourself. Know that your body's been through a lot. You just grew a human, which is incredible. So be kind to yourself, applaud yourself, and take this process slow. That's what I love about the MUTU program, is it's a gradual process, and you can always go back to an earlier stage. If you progress into higher impact exercises and you feel like it's just too much on my body right now, you go back and you do the basics over and over again, and you will feel how it benefits your body. You might still have those bladder leaks from time to time, but you'll feel, once you start to get in tune with your body, you will really feel the benefit. You will know when you're ready to move on to the next level or more intense pelvic floor strengthening exercises or exercise in general. Also, in this healing process of, if we have any kind of trauma to our perineum or our vaginal area and we're having bladder leaks, fully support wearing those pads, wearing that incontinence underwear until you feel comfortable. And that's sometimes saying, with my first baby, I had this mantra of I'm strong and I'm going to get back into a new normal. But right now, this is my normal. I need to heal. I need to rest. I need to heal. A lot of us as mothers want to go, 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 especially after we have a new baby, especially if we have other kids. And here's my reminder to you to slow down. It's okay to slow down. It's okay to wear the underwear. It's okay to have leaks. This program will help you build back to a new normal where leakage won't happen. But this is to reiterate that our bodies have been through a lot and it's normal. The fourth reason is overstretching of the bladder. So like I said previously, and I love reiterating this to new moms, pregnant moms, everyone, you have a lot of pressure on that area. You have a baby, you have a placenta, you have amniotic fluid, you have extra blood volume. That is a lot of extra weight in that region that your body's not used to having there, even if you have had multiple children before. So with that extra weight, your bladder can become overstretched, resulting in leaking as baby grows, and then even after in the postpartum period, because it's still dealt with all that weight for an exponential amount of time. After the birth of your baby, your bladder should slowly shrink back down to its normal size. But like we like to say a lot, pelvic floor exercises will also help that as well. And moving into that in a slow process. Also continuing to wear pads or incontinence underwear if you're feeling like you're having those leaks, and being kind to yourself too. The last thing, and it kind of has to do with number 4, this is number 5, is increased pressure on the bladder. We all feel it. I just went to the bathroom. I have to go to the bathroom again. It's been 3 minutes. I haven't had anything to drink, but there's a lot of pressure on my bladder. There is so much weight on my bladder right now. So the fact that my pelvic floor muscles are weak, the weight, the pressure, all of it results in my urine not being able to be held in as well as it was before I had a baby. This is totally normal. And just like your bladder, your womb, your uterus will go back down to its pre-pregnancy size after you have your baby. So same thing, being kind to ourselves, not rushing this process. It's going to be different for every single person. Actually, breastfeeding helps with that process. That's why when you breastfeed, you feel that cramping. That's your uterus going back down to size. So this is just a reminder of kind of what's normal, what our bodies have done, which is absolutely incredible, and that this program is made for you to be able to heal in whatever capacity you need. This program meets you where you need it. So you need to be at home, or you drop your baby off for 10 minutes with your parents, or whatever it may be. It's convenient because moms need to be convenient, especially new moms. We constantly have to adapt and change, and this program is there for you when you need it, at the pace that you need it. So most bladder leaks will improve over time on their own. Our bodies are absolutely incredible, but everyone needs pelvic floor therapy because look at how much our pelvic floor has been through, growing these babies, birthing these babies, carrying them for as long as we did. So take the time to heal, take the time to feel supported by the MUTU program, and it will do amazing things for you and your body. Check out the MUTU channel to see a video on 8 tips on how to handle bladder leakage, and thank you for watching. Have a great day.